Please welcome our next guest, Congressman Greg Murphy, a Republican from North Carolina, a doctor and co-chair of the GOP Doctors Caucus.
Hey,
Everybody.
Congressman, it's good to see you.
Good to see you.
I think the last time I saw you must have been on the green room for our Hill show on News Nation.
Yes, indeed.
Yes, very good to see you at some of our programming events again. Let's kick off with this. You're the co-chair of the GOP Doctors Caucus. What initiatives is the caucus currently prioritizing to improve healthcare quality, affordability, and access?
Boy, I could sit and talk for 3 hours on that. It would be a good one. I actually still see patients. So I'm the only one that's in House or the Senate, doctor-wise, that still sees patients. I do it because I love what I do. I think my patients appreciate it. But as equally important, I think it helps me stay in the trenches. We get a little bit cloistered up here. I think the term cubicle captains fits well from Washington, D.C. because we don't understand what's going on out in the real world. And so I'm literally this morning, I just came from our Doctors Caucus meeting, got a text from one of my colleagues back home, we need more doctors. We have a huge doctor shortage, and it is a dereliction, I think, on the leaders of medicine in the last 10 and 15 years to not understand this calamity was coming. It's an article put out by JAMA 30 years ago said there's going to be a surplus of doctors, and so they cut a lot of the slots back then.
Wow.
They had no clue what was going to happen. So access is a huge thing, meaning that people actually want to see a doctor or be able to see a doctor. We've done a great job in growing what we call our APPs, our advanced level practitioners, nurse practitioners, physician assistants, to help with that workload, but they are not doctors. They're not surgeons. I'm a surgeon, and they can't do that in the operating room. So growing our ability to put forth a workforce in a growing aging population. Look, I've actually spent more in healthcare in the last 18 months than I did in the last 50 years. But as we get older, we require more and more healthcare. So we need the people, physicians, to be there. How do you do that? We're having a real problem with a brain drain in our rural areas for physicians not being out in rural areas. I live in eastern North Carolina, Outer Banks. Who's been in the Outer Banks? Everybody's been in the Outer Banks? Everybody's been in the Outer Banks. Thank you. Please come more, spend your money. But that's an extremely rural area, and we don't have physicians out there. We used to have folks that would set up their shingle and be there for their entire career. The money's not there. There are Medicare, Medicaid populations that literally don't pay the bills. I don't know if any of you guys ever run a business, but if you buy a hammer and you try to sell it for $1, but you had to buy it for $1.50, you don't stay in business very long. And that's what we're dealing with Medicare and Medicaid. They simply don't pay the bills. So being able to pay physicians, literally the cost of care is what we're fighting for with Medicare, because it just doesn't do that. If you look at over the last 20 years, the reimbursement for physicians for Medicare patients has gone down, inflation adjusted, 33%. It's kind of like what Congress, we didn't get any raises, but we didn't get cuts. Physicians have gotten cuts and cuts and cuts. So if you're in those areas, which is heavily Medicare, Medicaid dependent, you can't keep the doors open. You can't pay your staff. And I'll just end with this. I tell this personal story. I worked so hard to keep my practice alive, my surgical practice. We're literally the busiest urology surgical practice in the state of North Carolina. I tried so hard to keep that open. The day I had to resign to come to Congress, I turned to my next senior partner and said, okay, well, here you go. Here's the keys to the place. This is how you do it. And he said, nope, we're not doing it. And I said, what do you mean? He goes, well, the hospitals made us an offer. And I said, okay. And he goes, well, and he points out to the fact that 3 out of the last 8 quarters, we had not taken a salary because we literally didn't have enough money coming in. After you pay your staff, you run a business, you pay your staff first, you pay your rent, you pay this, you pay yourself last. And so people now, physicians are moving to hospital employment, which is a much more expensive place of care, and it's also a much less efficient place of care. So if I had to say on 3 things, it's access, it's physician payment, and it's the destruction of healthcare delivery by vertical integration in the country.
And going back to the doctor shortage, that has to do with the just not being able to keep the doors open, essentially? Is that the broad?
Well, I mean, the doctor shortage really more is we're not graduating people to practice. One of the real critical things, if people have to really, hone down on this, we also have physicians who are coming out of medical school that don't practice. They may come out for 2 or 3 years and stop practicing. If they want to have a family, whatever, wonderful, but they don't practice anymore.
Yeah.
Or they'll practice 2 or 3 days a week, or they'll have some other venture. That's great. You should have never gone to medical school if that's what you were going to do. You should have been a PA or a nurse practitioner or something. You took the slot of someone who was going to practice for 25 years. And that has been the major factor, I would submit, in the reason why we have, other than they cut the spots, the shortage that we have today.
Right. I want to go back to Medicare regarding the recent funding bill. How are you going to continue to advocate for a permanent fix to Medicare physician pay beyond those short-term extensions?
Yeah, I've been here now 6 years in 5 days, I think. Surgeons, we have a little different mentality sometimes. We're sometimes not the most patient people in the world. We see a problem, figure a plan, execute it, move on. It has been the bane of my existence up here to see every year a cut, and just a patch. It's driven me crazy. I thought, coming out of the House in reconciliation last year, had a good plan to try to all of a sudden take this downward trajectory and start it on an upward curve. Very slow slope. It was not a big slope, but it was at least a change in the slope. The Senate just took it out and just said, well, we're going to do another patch. We are pleading, begging, trying to do everything we can to fix this problem. This is a problem that is going to cost a lot of money, but I can give you 5 times as much savings in the healthcare system that we have now to pay for this. We have to reverse this trend. Because I have colleagues my age. I'm the elder age of 62. Used to be the doctors would normally practice till their 70s, sometimes 75.
Right.
I got guys my age or even younger just saying, hell with this. I can earn almost as much being an Uber driver. I can do something else and get rid of this. And boy, that just destroys the entire career of knowledge, everything that you have to be able to take care of patients. We just have to reverse this trend.
Right. I have to ask, you're in a unique position because you're a surgeon and you're a congressman at the same time. What's that like? I mean, that's got to give you a very unique perspective.
It is. It's kind of funny. I love to go back and put on my scrubs and my white coat. It actually makes me human again. About 6-9 months ago, I'm in the operating room. You have to understand the dynamic between the surgeon and the head circulating nurse in the operating room, because it's always kind of a, who's in charge. And I've worked with this gal for a quarter century, and I said, damn it. She was fussing at me, and I said, damn it, I'm a member of the United States House of Representatives. And she said, damn it, not in here you're not. Now shut up and do what I said. So it gives me my life back again a little bit. I love patients. And it's the greatest job in the entire world. You get to meet people in a position where they trust you. You're trying to help them. Cancer is a horrible word, and it's the greatest profession in the world. It just gives me my life back.
Right.
Makes me feel normal.
Well, I hate to do this, but back to your other life in Congress. What policy levers do you believe that you and your colleagues in Congress should consider to support employers in offering, higher quality benefits?
Yeah, no, I think this is a real, we're at so many different moments here right now. With RFK coming in, and I'll just call what he's doing a healthy disruption. Some a little bit more than others. I mean, I think there can be obviously some debate about what's going on. But what he's brought back to the forefront is the fact that we as a nation are not healthy. Comparatively, if anybody, I'm sure everybody here has read the Maha report, all 74 pages back and forth. It's some really staggering statistics about what we're doing as far as the health and welfare of our nation. If you look at the 55 million individuals who are covered by corporate employer health plans, that is such a captive audience as to how we can actually make people healthier. Now, in a competitive environment where employers, at least in my part of the world, are screaming for employees, what can they do? What can they offer? How can they incentivize their employees to get healthy, cut costs, bring something in, and keep them there? I think it's a very reasonable thing to do. And I think this is one thing where our employers, some really actually do it pretty well. I have a couple of boat builders in my district that do a fantastic job on employee health. And that only means physical health, mental health, and some of the other things. It's a big attraction. But I think giving folks reasons to not live in the world of fast food all the time, which is, I think, is the biggest driver of obesity in the country, other than these damn things that are on our bodies all the time, these damn phones, especially with our kids. It's giving them a reason to eat healthier, to get out, walk, do things that are active, but become part of a corporate culture.
Right.
You know, we have the whole world of corporate culture where we're, you know, I don't want to say shoving things down people's throats, but it's an important mantra that we send home with people, not just at their workplace. You send home with people a different ideology. You make them healthier, the employer saves money.
Right.
Employer saves money, so it's really a win-win on everybody's part.
You know, you mentioned mental health, and I asked Congressman Schneider about this earlier. How much of a are you hearing about mental health and the broader conversation about healthcare when it comes to employer-based healthcare?
Yeah, no, guys, we have a mental health crisis, and we knew this was going to happen coming out of COVID with all the lockdowns. We can litigate that at another time, but it's a big deal. You look at the recidivism rate of people who are coming in, new employees. I think I saw one report with new employees of the Gen Z folks that 20% were fired after 18 months because they couldn't handle the job. So it's a real mental health problem, especially disproportionately probably affecting younger individuals than older individuals. And you want stability in the workforce for your employer. You don't want to have to retrain people. It's expensive. It's time consuming. You want to try to pull people in, keep them employed, keep them doing their job well. But mental health is really, truly an issue now. We've become over-medicated, and I think this is also, you go back to where food and nutrition and physical exercise really improve mental health. So again, it can be a win-win for employers that they have some type of program that deals not only with physical health, but also with mental health. You know, we have in our big hospital, there's a lot of resources. You know, being in medicine is an extremely, extremely stressful thing. I don't know if y'all ever been in an emergency room recently. The nurses and physicians are running around like crazy there. It's an extremely challenging environment. Also, just gosh, the workplace violence that you see in emergency departments, patients go crazy sometimes. So offering them some off-ramp not only helps with employment, but more importantly, really helps them with their own personal lives.
Right. What's in this conversation that we have about healthcare, oftentimes artificial intelligence or AI is brought up. What's your view on that, and how should employers and doctors approach that?
Yeah, we just had a little chat about that. So I look at AI as being 4 buckets that's going to happen in healthcare. One is diagnostic, being able to figure out what's going on with people. Another is therapeutic, how do we treat them? Another one is research, how do we improve research? Another thing is the legal aspect, and I'll hit on each of these just very individually. Diagnostic, if you look at some of my colleagues who are pathologists, they look at slides all day and they look at patterns. That's a computer-driven thing. Boom, that's 90% of pathology is going to be taken up that way. Therapeutics, we're going to be able to, hey, say, look on a screen. You walk into some places now, if the electronic medical record will listen to you and the patient and prescribe a note. Now, we've not gotten to the point, nor do I think we should, to saying, hey, this is what the recommendation is. But if everybody in here has Google MD, a lot of folks come into the doctor's office already knowing what's wrong with them, or at least saying they are, saying, hey, this is this, I want this drug. I hope we never get there. We will. Research is going to be critical. We do so many research studies now that require so many different lines of clinical trials. We hopefully will get to a point where we've learned from this in the past. This carbohydrate molecule does this. We don't need to do that anymore. And then finally, it opens up a huge legal bonanza. I just got through a meeting where the fellow was put down a little machine. Patients would call in, talk to an AI-generated, quote, nurse, be able to ask it questions, and the nurse would be able to respond. It's going to help with post-operative care. Is your wound okay? Is leaking this, that, and the other stuff? It's going to revolutionize medicine, but as we have to step back and always say, especially in this town, how are we going to pay for it?
Yeah, absolutely. Moving on, what do physicians want employers to understand about the realities of patient care? I think you touched on this earlier.
Yeah.
We could delve into that.
Well, I think it's important for physicians to understand, when patients come in, there's a whole different motivation. I had a little brain surgery last year. They went in, took out a little pituitary tumor. I was supposed to be in the hospital anywhere from 5 to 7 days. At 2 days, I was like, get me the hell out of here. That's one side. You have other people that sometimes I'll have to remove the mattress from the patient's room because they just want to stay in the hospital forever. There's a motivation to get people healthy, but also to get them back to work. There's a fine line because obviously in this world of interventions and medicines, you don't want to push people back too early by any means, but you also have to understand there is a normal recuperation period. We're doing a lot better with so much interventions. Gosh, when I came through, somebody had heart surgery, you had your chest cracked open and you were out for 6 months. Now you can go in, they go in through your groin, you get a stent in 48 hours, you're back at work.
Yeah.
It's just a communication as to what's a reasonable expectation. People do better. I think they truly recover better if they're back into their routine, if at all possible. Helping from a physician standpoint to have an employer understand that, not want them back too soon, but have them at appropriate time is best for everybody.
Right. Routine is very important. You brought up rural states like your home state of North Carolina earlier, and we know that employer-sponsored coverage sometimes struggle to connect with employees with local providers in those areas. So how can employers bridge that gap?
There are, in my part of the world, we've lost a lot of our primary care doctors, as I talked about. One of the great things is that some of our big employers, Hyster-Yale, which is a big company that makes forklifts, et cetera, in our district, they have nurses on site. And they'll have a physician that will come once a week to do checks, et cetera, if you need it. Having somebody on site is a win-win for everybody. Somebody can take a break for an hour, go see the nurse. If they're having a little headache, blood pressure issues, whatever. And that nurse can triage, get them back, say, hey, no, you need to go see a doctor, pick up the phone, try to get them in to see their primary care doctor that day or the next day. Or if it's something that can happen that can wait, a physician will come once a week to those places. It is in the world of, as we say, locum tenens medicine, which doctors travel around, it's a great, again, another win-win to have somebody on site, but it has to be economies of scale. You have to have enough employees to be able to do that. If you have a company, my practice, we had 50 employees. We were doctors because all the nurses would just come up and ask us stuff anyway. But if you have a smaller place, that's not really economically feasible, but larger corporations can have people on site. It really works wonders.
Right. I want to end on a positive note. We've been talking a lot about innovation in this space. What's one thing you're looking forward to when it comes to innovation in healthcare?
One thing, the things that, as I say, keep you up at night about physicians is making sure that people are able to get to a doctor, to be able to see a doctor. We're going to have so much now that is visible with AI. Telehealth is tremendous in our area. It was one of the huge wins, if you look at the silver linings of the pandemic, highlighted the great avenue of telehealth. My patients come from 2 hours north, 2 hours south, and if you look out at the coast, 5 hours or half a day one-way travel. For a 15-minute office visit, if I'm reviewing a lab test or if I'm reviewing a CAT scan or something, we can do that online. That's a huge innovation. It's a huge saver. Insurance companies don't want to pay for it because it does drive up utilization because you actually will go see the doctor rather than that. But that needs to stay. We're still working on reauthorizing this. It needs to be permanent and be done with it.
Absolutely. So. Well, Congressman Greg Murphy, thank you so much
for
joining me today.
Y'all have a great weekend.